Pacemaker implantation. A cardiac pacemaker is an electronic device implanted to regulate the heart's rhythm when the natural conduction system fails to maintain an adequate heart rate. It delivers electrical impulses to stimulate myocardial contraction and maintain effective cardiac output. A pacemaker is a battery-powered device that generates electrical impulses and delivers them to the heart through leads to maintain an appropriate heart rate and rhythm. Anatomy of the cardiac conduction system. The normal conduction pathway includes sinoatrial node, SA node, atrioventricular node, AV node, bundle of His. Right and left bundle branches. Purkinje fibers. Disorders affecting this pathway may require pacemaker therapy. Indications for pacemaker implantation. Bradyarrhythmias. Symptomatic sinus bradycardia, sick sinus syndrome, sinus node dysfunction, atrioventricular, AV, block. Second-degree AV block, Mobert's type 2, complete, third-degree, heart block. Advanced AV block. Other indications. Cardiac resynchronization therapy in selected heart failure patients. Certain congenital heart diseases. Post-cardiac surgery conduction disturbances. Types of pacemakers. A. Single-chamber pacemaker. One lead, usually placed in the right ventricle. Indications. Chronic atrial fibrillation with slow ventricular response. B. Dual-chamber pacemaker. One lead in right atrium. One lead in right ventricle. Advantages. Maintains AV synchrony. More physiological pacing. C. Biventricular pacemaker. Cardiac resynchronization therapy. Leads in right atrium, right ventricle, left ventricle, via coronary sinus, used for heart failure with ventricular dysynchrony. Components of a pacemaker. Pulse generator. Contains battery, electronic circuitry, microprocessor, leads, electrodes, flexible insulated wires that detect intrinsic cardiac activity. Deliver pacing impulses. Pacemaker pocket. A subcutaneous space, usually below the clavicle, where the generator is placed. Contraindications. Relative contraindications include active bloodstream infection, local infection at implantation site, temporary reversible causes of bradycardia. Examples: drug-induced bradycardia, electrolyte abnormalities, acute myocardial ischemia. Preoperative assessment, clinical evaluation, history and physical examination, assessment of symptoms, syncope, dizziness, fatigue, investigations, ECG, Holter monitoring, echocardiography, chest X-ray, blood tests, preparation, informed consent, review anticoagulant therapy, prophylactic antibiotics. Pacemaker implantation procedure. Step 1. Patient preparation, supine position, local anesthesia, sedation if necessary, sterile preparation and draping. Step 2. Venous access, common veins, cephalic vein, subclavian vein, axillary vein. Step 3. Lead placement, under fluoroscopic guidance, atrial lead, placed in right atrial appendage, ventricular lead, placed in right ventricular apex. Right ventricular septum. Step 4. Electrical testing. Evaluate, sensing threshold, pacing threshold, lead impedance. Step 5. Generator placement. Leads connected to pulse generator. Generator placed in subcutaneous pocket. Step 6. Wound closure. Hemostasis achieved. Pocket closed in layers. Sterile dressing applied. Pacemaker modes. Most modern devices use programmable DDD pacing. Complications. Immediate complications. Bleeding. Hematoma. Pneumothorax. Hemothorax. Arrhythmias. Cardiac perforation. Early complications. Lead displacement. Pocket infection. Wound infection. Late complications. Lead fracture. Lead insulation failure. Generator depletion. Pacemaker syndrome. Postoperative care. Monitoring, ECG monitoring, vital signs, device interrogation, imaging, chest X-ray to confirm lead position. Exclude pneumothorax. Activity restrictions. For 2 to 6 weeks, avoid heavy lifting. Avoid excessive shoulder movement on implanted side. Follow-up, device clinic visits, battery monitoring, lead function assessment, patient education. Patients should be advised regarding carrying a pacemaker identification card, reporting dizziness or syncope, attending regular follow-up visits, informing healthcare providers before MRI or surgical procedures, awareness of device alerts, if applicable. Summary: pacemaker implantation is a safe and effective procedure for treating symptomatic bradyarrhythmias and conduction disorders. The procedure involves transvenous lead placement and implantation of a pulse generator under local anesthesia. Proper patient selection, meticulous surgical technique, and regular follow-up are essential for optimal outcomes. Key takeaway: a pacemaker restores and maintains an adequate heart rate by delivering electrical impulses when the heart's natural conduction system is unable to do so effectively. Thank you so much.